Everyone, DrBiology here, and this is update 8. And today I'm going to be talking about test, track and trace. So it seems that we're over the worst of the first infection of COVID-19, and we're looking at the next stages in terms of fighting coronavirus in the future, and that's about tracking and tracing those who could have been infected. So as you'll probably be aware, over the last year, the testing of those that have COVID-19 has been scaled up. So there's been many more tests that are being done with key workers and frontline workers. And also for people not in hospital, tests can be booked online either by self-referral or by an employer. And these tests are done using a swab applied to the back of the throat. So a swab test can either be through the nose or through the throat. They then place the sample into a bottle and then it's sent to a laboratory for testing. And this testing is the RT-PCR method, which tells you whether you have the virus or you don't have the virus. And they're very good at detecting this. And the test results usually take about 48 hours. So testing sites, they've mainly been drive-through regional testing sites, and also mobile testing units are going around now and operating. And also they're sending out home swabbing tests as well. So there are all the sites. Now, obviously, there are many areas that don't have any sites at the moment. So that's the importance of bringing the mobile units through. So on to tracking. Now, we need to understand how coronavirus is spreading through the population, and what is being planned and what is being prepared at the moment is a study with 20,000 households that will be recruited and routinely tested over 12 months. So they're going to expand that testing as well, and they're going to expand the tracking, and they need to work out how it is spread through a population. So swab tests are going to be repeated every week for the first 5 weeks, and then every month for 12 months. Also with tracking as well, government are going to continue to publish national figures of COVID-19 infections and deaths. So what is new at this current time? So we are on the 5th of May 2020 is tracing using a digital app on your mobile smartphone. So it's the NHS has developed a smartphone app which will alert people that they've been exposed to someone with coronavirus. So it will use Bluetooth signals to log when the smartphone owners are close to each other, so less than 2 meters. And if an app user develops coronavirus symptoms, an alert is then sent to other app users with whom they have been in close proximity. So if we look at the diagram, so it shows you if one person is infected with COVID and you've had contact with these people, the alerts will be sent through, and then it could also then be relayed to more distant contacts so that you can go and get yourself tested. And if you do have COVID-19, you're making sure that you isolate yourself quickly to stop the spread. So what they're intending to use is smartphones. So the smartphones will ask you lots of questions about your symptoms. Obviously, you're not being tested for COVID-19, but if you have those symptoms, then it will suggest you have a test. So the new app has to be trialed, and they decided to trial it on the Isle of Wight. So Isle of Wight, if you don't know where it is an island to the south of England. It's very close to England. It is part of England, sorry. The reason they've chosen the Isle of Wight is that it's an enclosed small island. It only has one health authority as well. And they're going to test to see whether it can stop the transmission by warning people who've been exposed to the coronavirus, but not yet displaying symptoms. So they are trying to see if this works. If it does work, then they will be asking more people across the country to download the app. Combined with this, they'll continue to do what we call manual tracing. So manual tracing is part of what they call a multi-intervention strategy. So it's going to recruit 18,000 people for manual contact tracing by the middle of May, and they will interview people who test positive to find out where they have been and who they've been in contact with. So all of these measures should reduce the infections by COVID-19. So testing, tracking and tracing, coupled with social distancing and also washing your hands and making sure that you isolate yourself if you have symptoms, should stop the spread of COVID-19. So it's pretty positive. And there's lots of things that are going on at the moment. So more than likely there will be another update shortly. But in the meantime, stay home and stay safe. And thanks for listening. Thanks for listening. I'll be back shortly. Please do subscribe to DrBiology for more updates and more information on GCSE and A-level biology.